Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. On today's episode of the Body Fusion Therapy Podcast, we're going to be discussing this idea of the hierarchy of the organ systems and how that is affecting your musculoskeletal system and how your body is positioned. This concept comes up when I'm talking to patients about how they're just not getting better, that they'll be better for a little bit, but it's not the full effect. So we'll start off with, I love analogies. You guys will quickly learn I love analogies. So I say that any injury, unless it's a true traumatic injury, like you got into a car accident or you fell off your bike or something like that, where it was a trauma imposed upon you, I say all injuries are like a leak through your ceiling. So that ceiling tile, where you have pain, where you're feeling the dysfunction, the lack of motion, the discomfort, that's the ceiling tile. That's where you see the leak coming through. Water didn't just magically appear in that ceiling tile though, right? It didn't just come out of thin air right there. The leak started someplace. So my job as your therapist is to try to find where that leak started, stop the leak, and then go replace that ceiling tile. I mean, I always joke that it's a great business model just to replacing ceiling tiles because the patients will have to keep coming back at you. Because if you don't stop that leak, then yeah, they're going to be spending a lot of money replacing ceiling tiles. But I'd much rather find that leak, stop the leak, replace the ceiling tile, and then if you're happy with it, then you refer your friends that have leaky ceilings rather than me just staying with you the entire time. I want to get you better faster. I want to get you back to what you want to be doing in your life and not having to come see me. So with this idea of the leaky ceiling and that leak coming from someplace else and needing to find that leak, this is where this idea of the hierarchy of the organ systems really comes into play. So when people come into my office, oftentimes they have come in because they've tried many other practitioners and it hasn't worked. I'm unfortunately usually one of more of the last resort people, which I wish I wasn't. I wish people would come in sooner, but just sometimes it takes a little while to find me and to understand the philosophy and how this could affect what's going on with your body. So when someone comes into me and they say like, yes, I feel better for a little bit, but it comes back again. Like they might feel better for a couple months and they're having it come back again. Maybe they feel better for like a week and it comes back again. Maybe it's like within a day after having treatment from another practitioner, they're right back to where they started. When that happens, in my head, I go, ding, 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 ding. I think we have a problem with another organ system. So let's kind of break this down a little bit. If we were to look at all the different organ systems, when I say organ systems, because sometimes when I say that, people think that I'm just talking about the digestive tract. No, I'm talking you have your nervous system, your cardiovascular system, pulmonary, digestive, urinary, reproductive, musculoskeletal, and your integumentary system, which is your skin. So you have all these different organ systems going through your body. And there's two that are the highest of the high. And anybody that's watched any sort of medical TV drama or movie drama will know that medically you're considered dead or no longer alive if you are brain dead or if your heart stops. So your nervous system and your cardiovascular system are going to reign supreme. They are going to try to protect themselves and first and foremost, because with either of those not working, you're gone. And then everything else it kind of goes down in terms of, I'm not going to say that, pulmonary is the next most important. I'm not going to say what's going to be the next most important. Those two are the top, the nervous system, cardiovascular system, and then everything else kind of falls down below. Now, I personally say that the integumentary system, which is your skin, is probably the very bottom of the barrel. That's the bottom of the list. Skin is extremely important. It has its purpose. But in terms of that leading to a lot of issues, it's not as big when it comes to recurring injuries. Musculoskeletal system is right above that, because you can have an amputation. Like you could lose an arm and you could still survive. You could lose a leg, you could still survive. You could lose a toe and still survive. But you can't really lose can't lose a liver. Can't you need a liver. You can't really lose your small intestine. You can't lose your bladder. All these other organs are more important for your survival. Now, yes, there are medical advances in the world where, you really could live off one kidney if you needed to, or, you can take out some of the bowel and you'll still be fine. But in your body's mind, it doesn't want to have an effect of any of those other organ systems that's more important than the musculoskeletal system. So when someone's coming into my office and they're telling me that these things keep coming back, it's not getting any better, my first thought is that we need to go to one of these more important organ systems. I need to kind of go through their past medical history. I need to understand what got them to where they are now. Like, where could the possible have leak started? Where was there a little bit of a rumbling? Where was there a little bit of a breakdown of something before it got to that ceiling tile where it became much more obvious that there was a problem? And once I find out that, then I can go and treat it. And it's amazing how just naturally the musculoskeletal system starts to correct itself when you go after those specific areas. So, because the body wants to be efficient. Your body does not want to be in pain. It doesn't want to be functioning inefficiently, but it doesn't know how to help itself sometimes. There's a lot of great compensatory actions that your body will take, but at some point it just won't do it anymore. And so we need to find out what's making those compensations occur. And then once you release it, I love to see how the body just naturally starts to settle into its own proper positioning, its more efficient alignment, so that you're in less pain, and it maintains. Then if we stop that leak, then there's not as much coming through, and we can fix that ceiling tile and it will maintain. So let's take something specifically, because it might seem a little bit of a nebulous idea of this organ systems and how it's affecting everything. So let's take something that I see time and time again in my office, is that someone will come in with low back pain, and they've gone to, and in California, there's a lot of chiropractors. Chiropractic work is very popular here. But so they'll go to say like, yes, I go to a chiropractor, or I go to a physical therapist too. And when I'm looking at their body, after I've gone through their past medical history and I'm looking at their body, we're going to say their right innominate. So the right side of their pelvis is elevated. And they're like, oh yeah, that's always the way it is. Cause I'll say, oh, do you see that your right side's elevated as I'm looking at the kind of bony structures? And they'll say, yeah, no, that's always the way it is. Like, that's why I go see this person. They get it down again, but then in a couple of days, it's right back up again. Okay, well, that's not normal. It shouldn't stay. If it was just a joint dysfunction, if it was just a dysfunction purely in the musculoskeletal system, then if you immobilize it, it should stay. It shouldn't go back out again. I mean, yes, there are postural things that people might be doing. And that is something that I address with my patients, is their posture and how they're sitting, how they're walking, just kind of see if it keeps coming back, that dysfunction, then I'm like, okay, we need to explore in different areas. But at first I'm like, if it comes back that quick and, I don't think you're sitting in a crazy position, then what else could be the cause? So if we're looking at that right innominate, that right side of the pelvis being elevated and always being elevated, it comes down, but it goes back up again after treatment, then I can be looking at two organ systems more specifically. The first one I'm going to talk about is the digestive system. So inside the right pelvis, inside the abdomen, right in the pelvis, is the start of your large intestine, and that's called your cecum. So your large intestine, your colon, the cecum is the first part, and that's what's sitting in the right lower quadrant. This is also where your appendix is. So if there are adhesions of the fascia around the cecum that would, if the pelvis, if that right innominate was in a lower position, if that could be stretching and pulling abnormally on that cecum, your body will not allow that to happen, because it is way more important that you are able to move the food that you eat around and through your digestive system and be able to then have a bowel movement when it goes to the other side, to the left side, and goes out through the rectum. It is way more important for that to occur than you dealing with some back pain or dealing with an elevated innominate. Your body's like, so sorry, musculoskeletal system, you got to be the workhorse. You got to take it for the team. You're going to be in pain. You are going to be inefficient, but it's for the greater good. The greater good is that our body can function properly and it can get the feces out. So when I say this, it's not that there's a problem within the colon itself. The problem is the fascia suspending the colon. The organs aren't just thrown in there willy-nilly. They have a whole suspensory ligament network. And so if that fascia is stuck inside the pelvis, it will adhere that colon to the inside of that iliac fossa, inside the innominate. And then for the body to correct to make sure that that colon can work its most efficiently, it will elevate that innominate. And it will stay elevated then. It might be able to move down for a second, but then it will come back. It will go down for a second, but then your body's like, ha ha ha, that's great. I'm really happy that you want to be out of back pain. I understand you wanted a break or reprieve from this. But yet again, workhorse, musculoskeletal system, you got to take it for the team and you're going to go right back into elevation. So that's one thing that I can see. Another component, when coming specifically to the right innominate being elevated, would be any dysfunction of the dura. Now, the dura is, I describe it as the plastic wrap, the saran wrap around your entire nervous system, central and peripheral. It's its own set of fascia. The dura is its own set of fascia for the nervous system. And yet again, when we were just talking at the beginning of this podcast, the nervous system reigns supreme. Cardiovascular and nervous system are the most important organ systems in your body. And so they will protect themselves first and foremost. So if the coccyx, which is an anchoring point for the dura, so the coccyx is your tailbone, and it is one of the anchoring points of that dura, if it is not in a neutral alignment, it will cause tensions on the dura. Now, the dura does not want to be tensioned. It wants to be as loose as possible as it can around the nerves to keep the nerves, the blood flow, because you have your own set of artery and vein for the nerves, which is encased inside the dura. It wants to be in not restricted. It wants to have full blood flow motion. It doesn't need to be tensioned because your body's going to be like, warning, warning, warning. Because it doesn't want anything to happen to the nervous system. So when I talk about it, it's the dura, it's the connective tissue around the nervous system that can be restricted. Now, this can be restricted right at the tailbone. So there can be a problem with the tailbone not being in a neutral alignment, and that will move the pelvis out of position, out of neutral position, which is a common thing that we find. And you think about it, like I have a 4-year-old daughter, and when she was learning to walk, man, did she fall on her bottom all the time. Now, luckily, she had a diaper to kind of cushion the fall a little bit, but still, there's a lot of dysfunction that happens under your tailbone. Just think of all the times that you've slipped and fallen, or even just falling on your side too. That pressure from the side can move the tailbone out of alignment. It can shift it off to the side. And so that will put pressure on the dura, and then the dura is like, no, and asks the musculoskeletal system to get out of, to compensate for this restriction, and it will have them move out of position. So when someone keeps coming in, because the reason, like the pain that they're feeling is probably from tensions from having that innominate elevated. They could be having pain in their SI joint. They could just be having low back pain, just feeling kind of tension along the sides. But that's not the cause. The cause could be, it could be other things too in terms of organ systems, but the two most common I would see if it's on the right side would be either restrictions of the cecum or abnormalities through the line of tension of the dura. So we need to be able to address those first, because why am I going to keep doing what everybody else you have been seeing has been doing and not working? Like, why do I think that I'm this magician that no, I can do it the right way. They haven't been doing it the right way. I can do it the right way. I can do this joint mobilization. It will go back into place. And because I am a miracle therapist, it will stay there. No, trying the same thing over and over again, expecting a different result is insanity, right? Like we've heard that so many times. That's the definition of insanity. So I needed to investigate further. And I do that through my subjective intake, understanding their past medical history, what could have led them to where they are now, kind of understanding the chronological events and how the different organ systems are involved to be able to paint the picture of how they're what they are now. And so when you then treat those areas, like I said, there's times where I will just treat the tailbone at first. I will just treat the tailbone, just treat the coccyx, get that into a neutral position, and then I'll stand them up again. And I would say 8 times out of 10, the majority of that innominate dysfunction, the majority of that innominate elevation is fixed from treating just the tailbone, which the tailbone is not directly connected. It's connected to the innominate through some different ligamentous structures, but that's a big component where it's like, I'm nowhere near where their side of pain is, right? I'm down at the end of their tailbone. I am not on their lower back at their L5, S1, or their SI joint. So I can treat that. And then usually then I'll go into cecum and try to clear up cecum as well. So how do you figure out, if you're a practitioner or even if you're a patient, when you're kind of thinking of your own body, like what other organ system can be involved with what your problem is? So anatomy, a knowledge of anatomy is so important. And I am constantly pulling out my anatomy book, and I am not ashamed that I am pulling out my anatomy book to look at what organs or what structures are around and associated with the leaky ceiling tile, where that side of pain is. I think I'm constantly learning anatomy. There's so much to learn. There's so much that's coming out, even with cadaver dissection still, of where these trains of fascia are going and how they're all connected. So you need to understand the anatomy and think of, okay, well, if I tried just the joint mobilization, if I tried just the soft tissue mobilization and it's not sticking, it's not staying, and I talk to my patient about posture, or, if you're the patient, you're like, no, I swear I'm not sitting in a weird way. Like, I'm working on it. Okay, what else is in that area? What other organ system could have the impact that would say, musculoskeletal system, time to be that workhorse, take it for the team, go out of alignment, because it's for the greater good of our survival if you're a little dysfunctional right now. Sorry to say it, but you're going to be in pain. So I think you need to understand your anatomy really directly, and need to understand where everything's going and where everything's connected, and how that fascia, because yet again, physical therapists, we should be experts of the fascia, and fascia is going everywhere in the body. So we have the opportunity to treat everywhere. That's definitely within our wheelhouse. That's definitely within our practice axis, to mobilize the fascia. So you need to figure out where, what organ system could be associated with that, understand how everything's connected. And then I'm also asking my patients, like, I'm going through on every single person that comes into my room, no matter what they're coming in for, I am going through a review of all their organ systems. I have that on my intake form, but you'll be amazed how many people just say, like, no problem, no problem, no problem, because they're just used to, like, whatever, because they don't understand. Your patients coming in might not understand that you're going to be looking at the whole picture. You are going to be looking at the entire body and how its interplay is connected. You're not going to be looking just at the side of pain. You're not going to be looking just at that ceiling tile. So they'll probably just say, like, well, yeah, I have all these other issues, but that's not important to you. That doesn't affect what's going on with what you're going to be treating me for. So I look at that, and now my patients know more. And people that refer their friends to me, they say, oh yeah, no, just save yourself some time and put in all the information on the intake form, so then I don't have to go detective snooping to figure out what's going on when you're actually in my room, and we can use that time more effectively. But I am going through and I'm asking, how's the heart? How's the blood pressure? Any issues there? Okay, great. How about the lungs? Any history of, asthma? Any problems with the lungs? Okay, great. Now let's go, how about nervous system? Any falls onto your bottom? So that's looking at the tailbone, or the other anchoring point for the dura is the sphenoid bone, where your pituitary gland sits, like, up in your head. So I'm like, okay, any concussions? And if someone is over the age of 25, I'm saying, okay, any undiagnosed concussions? Because now we have much more knowledge of what a concussion is and the need for proper therapy and medical interventions to help with the concussion. So if they're over the age of 25, I say anything that was probably suspected, because I can tell you I've never been officially diagnosed with a concussion, but I have definitely had a few concussions in my life. So I'm asking, like, any concussions, any hits to the head? Okay, great. How's your digestion? Are you regular every day? If there is a hesitation, you can bet they are not regular every day. I always joke that if someone has great bowel movements, they will sing it from the rooftops. They want to tell you everything about their poop, which I will gladly hear because I want to know, because it's going to tell me how their body's functioning. And even if they do poop every day, is it the right color? Is it the right smell? Is it the right size? How often? What's going on? I want to know all of that because it's going to tell me how the digestive system is functioning. But if there is a hesitation on if they're regular every day, then I'm going, okay, let's talk about this. Do you have a bowel movement every day? I want to know what's going on with a digestive system, because the digestive system is huge in the body. It's going to be affecting upper extremity, lower extremity. It's going to affect basically all parts of the body. So I'm asking about their digestion. I'm asking about urination. Do they feel like they can fully empty their bladder? Do they wake up at night to go urinate? Because you shouldn't have to wake up in the middle of the night unless you're pregnant. But even like men with as they get to a certain age, they just assume that it's totally normal to have to wake up multiple times to go to the bathroom to urinate. Yeah, no, you shouldn't have to. Even in your older age, there should be mobility around your prostate, mobility around your bladder, so that you don't have to wake up in the middle of the night. So I'm going through all the different organ systems specifically and making sure that everything is functioning properly. And if they have a history of anything, I want to know. I want to know because it's going to help paint that picture. I've never had a patient be upset with me that I'm spending too much time going through their past medical history, because in most cases, like I'm explaining to them beforehand, if they're kind of like, oh, this is a lot. It's like, I need to bring the whole picture together, because you're coming in now and this is a snapshot I see, but what brought you here? And if you're coming into my office, you've probably tried a lot of other interventions that haven't worked. So I'm going to take the time to really try to understand where that leak started, where I need to go and stop that leak to then be able to replace that ceiling tile without spending all this money just replacing ceiling tile. So I think it's important to take your time to go through all the different organ systems and really specifically go through them to figure out what's going on, to paint that whole picture. Because if you're going to have an impact on that patient, like I said, musculoskeletal system is just taking it for the team. It is the best way to compensate in the body because it is everywhere. It is the structure of which all the other organ systems are able to function, is because of this framework of the musculoskeletal system. So it is the first thing that will go out of whack to protect those more important systems that are there for your survival. So when we're looking at the body, just don't forget to go everywhere. And like I said, we as physical therapists are specialists of the body. And we are specialists of the fascia. That is within your wheelhouse, that is within your practice acts, that is completely appropriate for you to be able to go after and search. Now, if you're finding something that's still not functioning right through the organ, that you're kind of questioning based on what they're telling you about their lab values that they have with their doctors, then you might say, okay, well, we need to get someone else in on this too. There's something happening within the organ itself that is not for you to fix. And you need to bring in another healthcare practitioner, another doctor to be able to evaluate and assess what is going on with, say the liver or the gastrointestinal tract or the heart or, what's happening with the blood vessels. So, but we have every right to look elsewhere in the body. And I think you need to understand that if someone keeps coming back, or if you yourself just keep getting frustrated that one dysfunction just keeps coming back, there is probably a more important organ system that is being affected. And that if you really want to stop the problem, you need to go find and figure out what is wrong with that other organ system and treat it out. So everybody start to open their minds to the possibilities of what could be happening. And like I said, this is all based in anatomy. Pull out those anatomy books. I personally love Netters. I think Netters is great at depicting what is, happening in kind of a fresh body, as to what the anatomy is and what the variations of anatomy is too. A lot of the Netters anatomy books have great pictures of the anatomical variations that you can find within patients. So pull out those anatomy books. open your minds to what is the fascia around that area, what could be impacting it. Start to educate yourself on how the other organ systems function. What is their job? What are they supposed to do? In this podcast, we're going to keep exploring those specifically so you can understand where some of these dysfunctions can be occurring, and what the causes and effects are when a certain organ isn't firing properly. But I just realized that it's more than just the musculoskeletal system. And if you really want to cause change and impact your patients, you need to be assessing the whole body and understanding the hierarchy of the organ systems and how that's leading to where they are now. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.